Private clinics must now fill feedback forms issued by the Health Ministry whenever they treat patients with influenza A H1N1. Health Minister Datuk Liow Tiong Lai says the completed forms must be sent back to the Ministry daily to ensure cases of the virus were reported accurately and quickly.
Keduanya, kita juga telah pun mengeluarkan borang kepada mereka untuk mengisi dan juga maklumkan kepada kita tentang rawatan yang diberi kepada pesakit-pesakit influenza like illness ataupun pesakit AH1N1 untuk mereka maklumkan kepada kerajaan agar kita dapat memantau keadaan wabak di peringkat akar rumbi. Semua pesakit-pesakit influenza AH1N1 akan dipantau dan juga diberi rawatan dengan secepat mungkin.
Liow said this after a dialogue session with various private medical associations in Putrajaya Thursday. He also says the ministry has given the private medical industry clear guidelines on treating patients suspected of having the pandemic virus.
Pada petang ini, kita telah pun menegaskan tentang rawatan yang perlu diberi dengan cepat. Rawatan yang sempurna perlu diberi kepada pesakit-pesakit AH1N1 dan semua garis panduan yang telah diberi telah dihuraikan dengan teliti dan mereka telah pun memahami dengan sepenuhnya keperluan dan juga kepakaran yang perlu dilaksanakan untuk memastikan rawatan yang baik dapat dilakukan.
Representatives from the Malaysian Medical Association, Malaysian Private Hospitals Association, Primary Care Doctors Organisation Malaysia and Federation of Private Medical Practitioners Association Malaysia were also present at the dialogue session. Some private medical practitioners have claimed that they are unclear on the ministry's guidelines. But Liow says the associations have been issued with flowcharts that detail the treatment and procedures to be given to the patients according to the risk levels involved. He explains that due to lack of facilities, private clinics must immediately refer all patients with moderate to high risk to either private or government hospitals for further treatment. He says this is to prevent late treatment of patients, a factor that the government has contributed as one of the reasons for the deaths related to the pandemic. Liow also says a World Health Organization monitoring team has indicated that Malaysia's pandemic surveillance is active and sensitive.
They concur with our finding, and also they found out that the H1N1 death surveillance, our surveillance system is sensitive and working very well. So that's how we can track them, and that is good for our monitoring as well as planning, as well as coming with more measures to handle the AH1N1 situation in Malaysia. So we will be continue to be vigilant to handle the situation.
Meanwhile, no new AH1N1 deaths were registered Thursday, leaving the death toll at 71, with 259 confirmed cases. Lee Mi-yuk, The Star, Malaysia.